Hi everyone, my name is Alison Keene and I am a licensed clinical mental health counselor with Keene Counseling, and I am located in the Raleigh area. Today I want to open up a conversation with you about caring for yourself in a COVID world. It's no surprise to anybody that the effects of COVID are far-reaching, from health, physical health, to also mental health and emotional health. We are all feeling the effects of a COVID world. And primarily, we can be feeling it as stress in our body. So today, we're going to talk a little bit more about what is that? What is the stress in our body? And how can we actively take care of ourselves and stay in connection with those around us so that we can be well during a time that's very uncertain. So I have attached a PowerPoint presentation for reference. So it may be helpful to pull that up along with this talk so that you can follow along and reference some of the things that I mentioned. And if not, that's okay too. Just kind of be along for the ride. So one of the first things for us to consider is what's called the stress response cycle. So in a time like this, there is a tremendous amount of stress, and our bodies respond to stress in a very defined way. When our body senses danger, our body becomes activated. We begin to have automatic thoughts, maybe thoughts like, I'm alone, the world's not safe, things are not okay. We begin to have negative moods and emotions. Some people experience irritability, anger, and panic. Then there's what's called maladaptive behavior. That can be things like increased eating, increased drinking, engaging in things that are not helpful to us, but help us to feel a little bit better in the moment. We also can engage in negative physical symptoms that have come out of this, such as pain, increased heart rate. So our body begins to respond to the stress that's around us and the perceived danger. Ultimately, what we want to happen in a stress response cycle is for our bodies to come back to a place of calm, to realize that we're okay and we have survived this stress. However, when stress is chronic and enduring and has been going on for 4 or 5, 6 months, it begins to get harder and harder for our body to come out of that cycle. So one of the things that can get our bodies and our minds and our emotions out of that cycle is self-care. So I reference self-care as connection. Connection to yourself, connection socially to the world around us, and connection spiritually to God and to the things that help us to feel grounded. Personal connection. So Richard Schwartz, in his theory on internal family systems, references being connected and centered and within ourselves with the 8 C's. That's being calm, compassionate, curious, creative, courageous, having clarity, having confidence. These 8 C's show us that we're in ourself, capital S, that we're doing okay, that we feel okay. So I have some questions that kind of guide, are we feeling personally connected? What are the things that I can do and practice in order to feel calm? Am I moving regularly? So one of the things that in this stress response cycle that we talked about is that when that cycle stays in motion, we can begin to feel stuck. We can begin to feel helpless. We can begin to feel like there's no way out of this. So movement, physical movement, can help break that cycle and can also help us to feel unstuck. Am I moving regularly? Also, am I aware of what I can control and releasing what I can't? And that is a much heavier and a much bigger question to unpack. But what I've included in the PowerPoint to reference is an exercise called Circles of Control. So I just invite you to take a second to walk through that exercise to get a better understanding of what are some of the things that are within your control, that you have direct influence and control over, And what are some of the things that are outside of the realm of your control? This is a great visual for us as we look at some of the things that feel very scary and very uncertain and outside of what we know that we can directly influence. And by taking a moment to walk through this exercise, we can reframe for ourselves what are the things that we actually can manage right now. So the next aspect of self-care after personal connection is a sense of social connection. Our brains and our bodies are social organs, not just physical. One study shows that the lack of social connection is of greater detriment to health than smoking, obesity, and high blood pressure. That really shows how much we need each other. I think of the movie Castaway with Tom Hanks too when I think of social connection. That even in times when we are deeply removed from contact with other people, we intrinsically begin to crave connection with something else. So even if it's Wilson, the volleyball that he turns into his friend, we are made for connection with other people. And it just shows and it highlights how deeply important this is to our own sense of well-being. Some creative social opportunities in a time that we really have to evaluate what we can and cannot do socially might be socially distanced gatherings at a park. It's been really fun for me to see driving on my way to work or being out and seeing groups of people gathered 6 feet apart in a park having coffee together. And to me, it just reinforces how deeply we need each other. That even when we can't gather at our favorite restaurant or at our favorite coffee shop like we used to, we're going to find ways to continue to connect with each other. It might look like increased video chats or family reunion Zoom meetings on a semi-regular basis. It might look like lunch meetings from separate vehicles. And I have just heard of some really fun and creative ways that people are finding to connect with each other. Some therapists that I have talked to have been meeting with clients from their truck when their client is in their own car. You know, this is a place of innovation to really begin to get creative with the ways that we can be with each other. Another way that we can be with each other is through therapy. I have had clients who have increased how often they're coming to therapy or even started coming to therapy because they have been in a place of isolation, and isolation can have deeply profound negative effects on us, mentally, emotionally, and overall. After social connection, the third connection that I want to touch on today is spiritual connection. Spiritual connection can be seen often throughout Scripture. We see it in John 15, talking about being connected, such as with the vine. We also see connection, the body and its parts. We just kind of see a deep theme that resonates through Scripture of connection with God, with each other, but true connection. Some questions I want to ask around spiritual reflection, just to kind of guide what is spiritual connection during this unusual time. How do I find myself responding to spiritual stillness? This is a time of deep quiet for a lot of people where things have settled down and there is not as much busyness and not as much spiritually to engage in these activities that where the scaffolding of our spiritual lives may not be active and going on, such as church attendance and Bible studies. So how do I find myself responding during this time of spiritual stillness? Another question is, are there spiritual and faith leaders who can speak to this time of contemplation and reflection? I think about desert mothers and fathers who intentionally sought out stillness, who intentionally sought out isolation, and the depth of faith and insight and reflection that came from that. Is there something that we can glean from those who have gone before us during a spiritual time like this? Also, there can be explicit spiritual connections. And things like that might look like attending an online or a Zoom Bible study, as well as reading the Bible, or attending church virtually or in person. All of those things are kind of tangible things that we can engage in to build our spiritual lives. There are also implicit spiritual connections, and those are often the things that are not seen in the same way. That can be something like gardening, watching the sunrise or the sunset, stillness and meditation, taking a walk and actually noticing and hearing and feeling what is around you. The implicit spiritual connection are the ways that we find ourselves becoming still and quiet and connected to God, even without hymns, without the Bible around, or without preaching. But yet that connection becomes strengthened as well. So today we just took a few minutes to talk about how to care for ourselves, looking at the stress response cycle that we can often get into a stress loop that becomes difficult to bump out of if we aren't engaging in self-care. Self-care can look like personal connection, social connection, and spiritual connection. So if you have any questions about anything that you've seen in this PowerPoint, or if you want to take a deeper dive into understanding how you personally can engage deeper into self-care and can help care for the people around you in the way that you care for yourself, I encourage you to reach out to me, reach out to the Raleigh Baptist Association, and continue to engage in the things that help you to feel well. Thank you.
Very nice.